Welcome to a quick informational video on gestational diabetes, and congratulations on your pregnancy. First, a quick overview. We will explain what gestational diabetes is, the proper treatment, how to perform a subcutaneous injection, signs and symptoms to watch for, and finally, great support services. In Canada, 54.5 out of 1,000 births had mothers with gestational diabetes. Know you are not alone in this journey and that there are many supports to help you through.
So what is gestational diabetes? Gestational diabetes is a type of diabetes that is first noticed during pregnancy. This condition may occur in those with underlying diabetes or may only be present during a pregnancy and resolve after the baby is born. In either case, the condition occurs because the body is unable to effectively control blood sugar levels with the insulin it is currently producing. Insulin is the hormone that allows glucose to provide nourishment to the tissues in the body. Its function is vital in controlling blood sugar levels. Diabetes can develop during pregnancy because hormones produced from the placenta causes the body to be less responsive to insulin. If the pancreas is unable to produce more insulin to compensate for this temporary insulin resistance, it results in higher blood sugar levels. Properly managed gestational diabetes does not cause malformations or direct harm and will not cause diabetes in your infant. Although, to maintain your infant's health, it is important to consider breastfeeding immediately after birth and for at least 4 months to prevent low levels of blood sugar in your newborn. However, untreated gestational diabetes is associated with a larger birth weight as the baby receives higher levels of glucose through the placenta, as well as an increased risk of developing type 2 diabetes and obesity later in life. This can affect labor and delivery and increase the chances of having a cesarean delivery. It is also associated with the development of high maternal blood pressure, which can pose risk for both you and your baby as it adds stress to your heart and kidneys, as well as increasing your chance of developing preeclampsia.
How is it treated? The first approach to treating gestational diabetes is the initiation of a low sugar and low carb diet, regular physical activity, and frequent tracking of one's blood glucose level using a blood glucose meter. It is recommended to discuss potential diets and exercise regimens with your healthcare provider and dietitian to find one that fits your cultural and dietary needs. Blood glucose meters, such as these, are used to test blood sugar levels in a small drop of blood. Included in a blood glucose meter kit are testing strips, lancets, and the device itself. It is important to test your blood glucose levels often and keep track of them using a method of your choosing, such as a diary or app. Tracking your levels will allow you to learn your baseline to have a better understanding of your body throughout your journey with gestational diabetes. If these measures have not been effective in managing your blood sugar levels, your healthcare provider may recommend using insulin injections as an addition to your regimen for the remainder of your pregnancy to keep your blood sugars within the desired range. It is important to know that needing to use insulin to treat gestational diabetes is through no fault of your own and solely relates to your body's biological needs. Also, throughout your pregnancy, the doses of insulin will change. Typically, the doses needed in the first trimester will double or more during the second and third trimesters. After delivery, your blood glucose levels should return to their normal ranges within 1 week. Make sure to follow up with your healthcare provider as you are now at a significantly increased risk for developing type 2 diabetes within your lifetime.
Giving yourself insulin injections can be an intimidating process. In this section, we will go over the components of a typical insulin pen and demonstrate easy-to-follow steps to complete an injection. Prior to starting your insulin regimen, be sure to pick up a Sharps container from your local pharmacy. They are provided at no cost and are returned to the pharmacy once full. Next, we will go over the subcutaneous injection sites. A subcutaneous injection is an injection into the first layer of tissue on your body. There are various areas in which you can perform a subcutaneous injection. First, there is the back of the upper arm, second, the stomach area, and thirdly, the upper side of the leg. Each time you administer an injection, be sure to switch the site of injection, something called rotating. If you continuously inject in the same area, you risk scar tissue formation, which makes the injections harder. For all the injections, make sure to pinch the skin to ensure the injection is only reaching the first layer of tissue. For the upper thigh, landmark between the areas indicated. For the upper arm, again, landmark between the areas indicated. For the stomach, make sure to not inject 5 centimeters from the belly button. Don't worry, for your first injection you will be with a healthcare provider, and if you ever have any questions, you can always contact your doctor or local pharmacy. With your prepared insulin injection pen ready, take a sealed disposable needle and remove the protective tab. Screw the needle firmly onto the yellow cap of the pen. Pull off the protective needle cap and set it aside. This will be needed to dispose of the needle after the injection is complete. Remove the inner needle cap carefully and dispose of it. Before each injection, you will want to check the insulin flow, something called priming. To do this, pull out the dose button located at the end of the pen and set it to 1 unit. 1 increment is equal to 1 unit. If you are using a new cartridge for the first time, the number will instead be set at 4 units. Hold the pen upright and tap the cartridge holder gently to raise any air bubbles to the top. Press the dose button in until you hear or feel a click. This indicates that the set dose has been completely administered and the display will now read 0. It is important to note whether or not a drop of insulin appeared at the needle tip in this step. If no drop appeared, repeat the last 4 steps until a drop appears at the needle tip. This is important as you may not receive your full dose of insulin if it's not working. Now, you're ready to set the dose as discussed with your healthcare provider. Pull out the dose button and select the units needed to inject. To inject, you will pinch a section of skin within the desired injection site with your non-dominant hand and hold the injection pen firmly in the other as shown. Swiftly inject the pen and press the dose button in until you hear or feel a click. Leave the needle in place for at least 6 seconds to ensure that the required dose has been fully delivered. Withdraw the needle and ensure that the display reads 0 once again. Immediately replace the outer needle cap with one hand as shown. Unscrew the needle and dispose of it in the sharps container. A used needle should always be removed to maintain your device.
Signs and symptoms to watch out for with gestational diabetes. If your blood sugar levels drop too low, you may enter into a state of hypoglycemia. This may happen if you do not eat enough food, skip meals, take too much insulin, or increase your activity levels more than usual. When your sugar levels are too low, you will notice some shakiness in your hands and feet. You may experience dizziness, sweating, irritability, anxiety, and/or hunger. What to do when you experience these symptoms? Firstly, find a safe location to sit down. If you have glucose tablets, take 3 to 4. If these are not available, eat or drink foods with high sugar content, such as 4 ounces of fruit juice or 1 tablespoon of honey, or table sugar dissolved in water. Liquids will reverse the effects of hypoglycemia faster than solids. Test your blood sugars again after 15 minutes have passed to ensure that your levels have risen. It is a good idea to carry quick sugar food with you as a precaution and to avoid driving if your blood sugars are running low.
Conversely, if your blood glucose are exceedingly elevated, you will enter a state called hyperglycemia. This may happen when you have consumed too much sugar, such as eating a large meal with a decadent dessert, or forgetting to take your routine dose of insulin. When your sugar levels are too high, you will notice an increase in thirst. You may experience headaches, blurred vision, difficulty concentrating, possibly frequent urination, and fatigue. If you notice these symptoms, drink water, as it will help eliminate excess sugar while you urinate. Go for a walk or do other forms of exercise to work off some of that excess sugar. Also, take a supplemental dose of insulin as prescribed by the healthcare provider. Lastly, there is another complication that could result from gestational diabetes called diabetic ketoacidosis. DKA is a severe form of hyperglycemia. Now, these symptoms are markedly more pronounced by a rapid increase in heart rate, dehydration, disorientation, and deep labored breathing. The occurrence rate during pregnancy is rare, but if it occurs, please go to your local hospital's emergency department immediately. To avoid these conditions, it is recommended that your fasting blood sugar levels be below 5.3 millimoles per liter, but remain above 3.7 millimoles per liter to avoid incidences of hypoglycemia. You should also inform your friends and family of these crucial signs and symptoms of hypo and hyperglycemia so that they may recognize if you enter into these states while in their company and may take action appropriately.
Here are some additional services and resources to support you in your journey with gestational diabetes. There are many support groups to join and various informational sessions to attend, such as Diabetes Canada, Canadian Diabetes Association, and 811. Thank you for taking the time to watch this video. We hope you've learned some useful information and that you feel more confident in taking control of your gestational diabetes.